Welcome back, future nurses. Today, we're diving into one of the most critical areas of the Nclex, prioritization. These are the questions that separate pass from fail, and the ones new nurses struggle with the most. If you've ever wondered, who do I see first? Which action is priority? What's the safest choice? This video will transform your thinking. Get ready for 50 high-yield, exam-level prioritization questions, each with rationales and strategies that will help you master the Nclex's most challenging decisions. Stay locked in, take notes, and let's level up your nursing judgment together. Question 1. A community health nurse identifies an increase in tuberculosis cases among migrant workers. What is the nurse's priority action? A. Provide educational pamphlets. B. Notify the public health department. C. Host a community TB awareness class. D. Encourage workers to wear masks. Correct answer, B. Notify the public health department. Rationale: TB is a reportable disease requiring mandatory notification for surveillance and outbreak control. Strategy: reportable disease, notify immediately. Question 2. A nurse finds a client with COPD extremely short of breath, sitting upright, and using accessory muscles. What is the priority action? A. Encourage coughing. B. Administer high-flow oxygen. C. Check oxygen saturation. D. Notify the provider. Correct answer, C. Check oxygen saturation. Rationale: assessment must occur before intervention unless the patient is pulseless or unstable. Strategy: airway issue, assess first, unless emergency. Question 3. A client with a potassium level of 2.9 milliequivalent/L reports palpitations. What should the nurse do first? A. Place the client on a heart monitor. B. Notify the provider. C. Administer potassium. D. Recheck potassium level. Correct answer, A. Place the client on a heart monitor. Rationale: monitoring prevents fatal dysrhythmias. Strategy: cardiac risk, continuous monitoring first. Question 4. A nurse enters a room and finds a client with a chest tube suddenly experiencing severe dyspnea and tracheal deviation. Priority action? A. Call rapid response. B. Notify the provider. C. Increase oxygen. D. Check drainage system. Correct answer, A. Call rapid response. Rationale: tracheal deviation equals tension pneumothorax emergency. Strategy: life-threatening signs, call rapid response. Question 5. A nurse receives report on 4 clients. Which should be seen first? A. COPD client requesting PRN inhaler. B. Asthma client with wheezing. C. Pneumonia client with O2 sat 88%. D. Post-op client with mild pain. Correct answer, C. Pneumonia client with O2 sat 88%. Rationale: low oxygen saturation threatens airway and breathing. Strategy: ABC's oxygenation first. Question 6. A client with diabetes is confused and diaphoretic. What is the priority? A. Obtain glucose level. B. Call provider. C. Provide orange juice. D. Reorient the client. Correct answer, A. Obtain glucose level. Rationale: assess blood glucose to confirm hypoglycemia before treatment. Strategy: assess before acting. Question 7. A post-op client suddenly develops chest pain and shortness of breath. First action? A. Listen to lung sounds. B. Apply oxygen. C. Notify the provider. D. Check surgical incision. Correct answer, B. Apply oxygen. Rationale: oxygen improves perfusion in possible PE. Strategy: CAB oxygenate first. Question 8. During morning rounds, which client should the nurse see first? A. Client with fever of 100.9 degrees Fahrenheit. B. Client with oxygen saturation of 89%. C. Client with nausea. D. Client needing morning medications. Correct answer, B. Client with oxygen saturation of 89%. Rationale: impaired oxygenation is top priority. Strategy, physiological instability is first. Question 9. A nurse notices a blood transfusion reaction beginning. What is the first action? A. Notify provider. B. Stop the transfusion. C. Check vitals. D. Disconnect all tubing. Correct answer, B. Stop the transfusion. Rationale, stops exposure to the reaction-causing blood. Strategy, something wrong during transfusion, stop transfusion. Question 10. A client with sepsis has BP 78/48. Which action is priority? A. Increase 4 fluids. B. Call provider. C. Reassess BP manually. D. Administer antibiotics. Correct answer, C. Reassess BP manually. Rationale, confirm life-threatening hypotension before intervention. Strategy, validate abnormal vitals before treating. Question 11. A client taking warfarin has bleeding gums. Priority action? A. Check INR. B. Notify provider. C. Hold warfarin. D. Educate client. Correct answer, A. Check INR. Rationale, must assess coagulation level before intervention. Strategy, assess, then act. Question 12. A client is found unresponsive and pulseless. First action? A. Call the provider. B. Start chest compressions. C. Get crash cart. D. Administer oxygen. Correct answer, B. Start chest compressions. Rationale, CPR begins immediately in cardiac arrest. Strategy, CAB compressions first. Question 13. A nurse notices a fire in a client's room. What is the priority? A. Extinguish the fire. B. Close the door. C. Rescue the client. D. Pull the fire alarm. Correct answer, C. Rescue the client. Rationale, race, rescue alarm contain extinguish. Strategy, safety first rescue. Question 14. A client with a new tracheostomy has bubbling at the insertion site. What is the priority? A. Reinforce dressing. B. Assess airway patency. C. Notify provider. D. Clean the site. Correct answer, B. Assess airway patency. Rationale, air leak may compromise breathing. Strategy, airway always first. Question 15. A nurse enters a room and sees a client seizing. First action? A. Insert oral airway. B. Turn client to the side. C. Obtain vital signs. D. Call provider. Correct answer, B. Turn client to the side. Rationale, prevent aspiration and maintain airway. Strategy, during seizure protect airway. Question 16. A pregnant client with preeclampsia has BP 168/110 and severe headache. Priority? A. Administer acetaminophen. B. Assess reflexes. C. Notify provider. D. Administer magnesium sulfate. Correct answer, C. Notify provider. Rationale, warning sign of worsening condition, immediate evaluation needed. Strategy, sudden neurosymptoms equals provider ASAP. Question 17. A client receiving TPN suddenly becomes diaphoretic and shaky. Priority? A. Stop TPN. B. Check blood glucose. C. Call provider. D. Give 50% dextrose. Correct answer, B. Check blood glucose. Rationale, must confirm hypoglycemia before treating. Strategy, validate first. Question 18. A newly admitted client with heart failure has 4+ pitting edema and crackles. Priority? A. Obtain weight. B. Elevate legs. C. Assess respiratory status. D. Restrict fluids. Correct answer, C. Assess respiratory status. Rationale, crackles may indicate pulmonary edema. Strategy, airway breathing first. Question 19. A nurse finds a client attempting to pull out their 4 lines. Priority? A. Apply restraints. B. Call provider. C. Reorient the client. D. Assess for hypoxia or infection. Correct answer, D. Assess for hypoxia or infection. Rationale: acute confusion may be caused by physiological problems. Strategy: look for causes before acting. Question 20. A client on heparin infusion has back pain and decreasing BP. What is the priority? A. Document findings. B. Stop heparin. C. Administer protamine. D. Notify provider. Correct answer, B. Stop heparin. Rationale: suspected internal bleeding, stop anticoagulation. Strategy: bleeding plus heparin, stop infusion. Question 21. A client with atrial fibrillation suddenly reports chest pain and shortness of breath. What is the priority action? A. Check blood pressure. B. Administer oxygen. C. Notify the provider. D. Take a 12-lead ECG. Correct answer, B. Administer oxygen. Rationale: airway and oxygenation take precedence in suspected PE or ischemia. Strategy: ABC oxygen first. Question 22. A nurse notices a client's urinary output is 15 milliliters per hour. What is the priority action? A. Increase oral fluids. B. Reassess bladder. C. Notify the provider. D. Check 4 line for patency. Correct answer, D. Check 4 line for patency. Rationale: ensure there is no mechanical issue before reporting. Strategy: validate equipment first. Question 23. During a disaster, which client should be seen first? A. Open fracture with controlled bleeding. B. Client unresponsive with slow respirations. C. Client with minor abrasions. D. Client walking with shoulder pain. Correct answer, B. Client unresponsive with slow respirations. Rationale: compromised airway/breathing life-threatening. Strategy: start triage, breathing is priority. Question 24. A client with DKA has Kussmaul respirations. What is the priority? A. Administer insulin infusion. B. Assess airway and breathing. C. Start 4 fluids. D. Check blood glucose. Correct answer, B. Assess airway and breathing. Rationale: severe acidosis compromises respiratory stability. Strategy: ABC first. Question 25. A nurse finds a client's chest tube disconnected on the floor. What is the priority? A. Reconnect tubing. B. Notify provider. C. Place end of tube in sterile water. D. Cover site with gauze. Correct answer, C. Place end of tube in sterile water. Rationale: prevents air entry, avoids pneumothorax. Strategy: protect the system first. Question 26. A client with cirrhosis is vomiting blood. What is the priority? A. Obtain CBC. B. Insert NG tube. C. Maintain airway. D. Start 4 fluids. Correct answer, C. Maintain airway. Rationale: GI bleed plus vomiting blood, airway obstruction risk. Strategy: airway protection first. Question 27. A client with a spinal cord injury at T4 complains of pounding headache and sweating. First action? A. Check catheter for blockage. B. Give antihypertensives. C. Notify provider. D. Recheck blood pressure. Correct answer, A. Check catheter for blockage. Rationale: autonomic dysreflexia trigger must be removed first. Strategy: treat the cause, remove stimulus. Question 28. A client receiving morphine 4 has RR of 8. What is the priority? A. Notify provider. B. Stimulate the client. C. Administer naloxone. D. Check sedation scale. Correct answer, C. Administer naloxone. Rationale: respiratory depression is life-threatening. Strategy: RR below 10 naloxone. Question 29. A nurse notices the 4 site is red, swollen, and painful. Priority action? A. Slow the infusion rate. B. Apply warm compress. C. Stop the infusion. D. Elevate the extremity. Correct answer, C. Stop the infusion. Rationale: prevents further infiltration or phlebitis. Strategy: something wrong with force-stop infusion. Question 30. A client with COPD has a new oxygen order of 6 liters per minute nasal cannula. What is the priority? A. Implement the order. B. Call the provider for clarification. C. Document oxygen use. D. Apply mask instead. Correct answer, B. Call the provider for clarification. Rationale: high O2 can suppress COPD respiratory drive. Strategy: question unsafe orders. Question 31. A client receiving chemotherapy has WBC 1-200/mm superscript 3. Priority action? A. Educate on handwashing. B. Place in neutropenic precautions. C. Notify provider. D. Restrict visitors. Correct answer, B. Place in neutropenic precautions. Rationale: prevents infection in severe neutropenia. Strategy: immediate safety, implement precautions. Question 32. A nurse notes the chest tube dressing is saturated with blood. First action? A. Reinforce dressing. B. Notify provider. C. Change dressing. D. Check vital signs. Correct answer, D. Check vital signs. Rationale: determine hemodynamic stability. Strategy: assess before acting. Question 33. A client receiving 4-nitroprusside suddenly develops confusion. Priority? A. Slow the infusion. B. Notify provider. C. Check thiocyanate level. D. Assess blood pressure. Correct answer, D. Assess blood pressure. Rationale: nitroprusside can cause sudden hypotension, decreased perfusion. Strategy: ABC perfusion assessment. Question 34. A client with acute asthma attack stops wheezing and becomes drowsy. Priority? A. Give albuterol. B. Prepare for intubation. C. Check oxygen saturation. D. Notify provider. Correct answer, B. Prepare for intubation. Rationale: silent chest equals no air movement, impending respiratory failure. Strategy: life-threatening respiratory decline. Question 35. A diabetic client reports blurred vision and dizziness. What is the first action? A. Give snack. B. Check glucose level. C. Notify provider. D. Reassess in 15 minutes. Correct answer, B. Check glucose level. Rationale: hypoglycemia must be confirmed. Strategy: assess first. Question 36. A postoperative client has no urine output for 8 hours. Priority? A. Increase 4 fluids. B. Perform bladder scan. C. Notify provider. D. Palpate bladder. Correct answer, D. Palpate bladder. Rationale: quick assessment to determine retention. Strategy: least invasive assessment first. Question 37. A client with pneumonia is confused and restless. Priority? A. Reorient the client. B. Assess oxygen saturation. C. Give PRN anxiolytic. D. Notify the provider. Correct answer, B. Assess oxygen saturation. Rationale: confusion may indicate hypoxia. Strategy: ABC oxygen assessment. Question 38. A nurse hears a high-pressure alarm on a ventilator. First action? A. Call respiratory therapist. B. Check for kinks or obstructions. C. Silence the alarm. D. Suction the client. Correct answer, B. Check for kinks or obstructions. Rationale: most common cause of high-pressure alarm. Strategy: fix the simple things first. Question 39. A client with meningitis becomes increasingly drowsy. Priority? A. Reduce stimuli. B. Assess airway. C. Notify provider. D. Check temperature. Correct answer, B. Assess airway. Rationale, neurological decline threatens breathing. Strategy, ABC before neuroassessment. Question 40. A client with a cast reports numbness and severe pain unrelieved by medication. Priority? A. Apply ice. B. Elevate limb. C. Call provider. D. Assess pulses. Correct answer, D. Assess pulses. Rationale, suspected compartment syndrome. Assess neurovascular status. Strategy, check circulation first. Question 41. A patient with a sodium level of 122 milliequivalent/L is confused. Priority action? A. Seizure precautions. B. Notify provider. C. Restrict fluids. D. Reassess sodium level. Correct answer, A. Seizure precautions. Rationale, severe hyponatremia, high seizure risk. Strategy, first prevent harm. Question 42. A client on digoxin reports nausea and visual halos. Priority? A. Withhold digoxin. B. Check digoxin level. C. Assess apical pulse. D. Notify provider. Correct answer, C. Assess apical pulse. Rationale, must assess heart rate before withholding. Strategy, assess, then act. Question 43. A client receiving blood begins to feel chills. Priority? A. Document. B. Slow infusion. C. Stop transfusion. D. Check temperature. Correct answer, C. Stop transfusion. Rationale, early transfusion reaction, stop immediately. Strategy, transfusion issue, stop blood. Question 44. A postpartum client suddenly develops chest pain and dyspnea. Priority? A. Assess oxygen saturation. B. Administer oxygen. C. Call rapid response. D. Check blood pressure. Correct answer, B. Administer oxygen. Rationale, suspected PE oxygenation first. Strategy, ABC. Question 45. A client with an NG tube has 900 milliliters green drainage in 2 hours. Priority? A. Clamp the tube. B. Check electrolyte levels. C. Reassess drainage rate. D. Notify provider. Correct answer, C. Reassess drainage rate. Rationale, confirm abnormal value before reporting. Strategy, assess first. Question 46. A client is anxious and hyperventilating. What is the first action? A. Give paper bag. B. Have client slow breathing. C. Assess oxygen saturation. D. Notify provider. Correct answer, C. Assess oxygen saturation. Rationale, must rule out hypoxia. Strategy, ABC oxygen assessment. Question 47. A client with heart failure gains 4 pounds in 24 hours. Priority? A. Administer diuretics. B. Assess lung sounds. C. Call provider. D. Restrict fluids. Correct answer, B. Assess lung sounds. Rationale, rapid weight gain, fluid overload, pulmonary edema risk. Strategy, assess respiratory status first. Question 48. A client on a PCA pump is difficult to arouse. First action? A. Stop PCA pump. B. Check oxygen saturation. C. Notify provider. D. Increase 4 fluids. Correct answer, B. Check oxygen saturation. Rationale, sedation, respiratory depression possible. Strategy, ABC oxygen check first. Question 49. A client with a pacemaker reports dizziness and near syncopal episode. Priority action? A. Notify the provider. B. Check apical pulse. C. Apply oxygen. D. Get ECG. Correct answer, B. Check apical pulse. Rationale, must determine pacemaker capture and cardiac output. Strategy, assess before acting. Question 50. Which client should the nurse assess first during shift change? A. Client requesting pain meds. B. Client with BG 198 mg per deciliter. C. Client with new onset slurred speech. D. Client awaiting discharge. Correct answer, C. Client with new onset slurred speech. Rationale, possible stroke time-sensitive emergency. Strategy, new neurodeficit equals top priority. Great job making it to the end. If you worked through all 50 prioritization questions, you're already way ahead of thousands of NCLEX test takers. Remember, prioritization is all about safety, ABCs, and recognizing the real emergency. Replay these questions, study the strategies, and keep practicing until these decisions become automatic. If you want more high-quality NCLEX questions, thumbnails, or entire study playlists, just let me know. I'm here to help you pass on your first attempt. Don't forget to like, share, and save this video so you can come back during your final review. See you in the next one, Future RN.